Hi, everybody. We're going to talk about sample and OPQRST questions today. Uh, these are ways for us to remember a series of questions that we're going to need to ask our patients. One's good with the past medical history of the patient, and another is good with the present medical history or the present injury situation that's happening at the moment. But one of the things that we're going to need to learn how to do is to ask the appropriate questions of our patients to be able to get the most information out of them so we can do things like clearly understand their chief complaint, clearly understand their medical or traumatic situation, what their injuries or sicknesses might be, um, and then be able to take that information, make a good differential diagnosis, and then narrow down our field into figuring out what our final diagnosis is going to be for the patient. It's also, and that'll lead us directly into our patient care. So, what interventions are we going to do with these patients, that kind of thing. So, but it all happens with these questions. This is where we really get into our detective work that we've been talking about. So let's start talking about these guys here. All right. Sample and OPQRST are anagrams to remember questions designed to gather the info about a patient's past medical history. OPQRST is for the pertinent medical history or history of the present illness or injury there. As an anagram, as we understand, each letter is going to stand for something. So the S in sample stands for signs and symptoms. All right, so we have to ask questions that are going to elicit responses from our patients that are going to tell us what their signs and symptoms are of their illness or injury. Okay, so a good example of that is, can you tell me how you're feeling? Pretty simple, right? How are you feeling? What symptoms are you feeling? Um, just very basic questions like that. This one's not too hard, right? So this is, a very easy way to start our detective work here to kind of open the doors for everything else. Is, can you tell me what's going on? How are you feeling? And hopefully they'll tell us their symptoms after that. Signs, obviously, those are things that we observe, that we see or hear there, or even smell or feel. So the patient's not going to really be able to tell you about those, right? They're not going to tell you like, oh, I look pale, right? That would be a sign that we could observe. Signs we're going to gather on our own, but symptoms, asking the question of the patient of how they feel, is just, can you tell me how you're feeling? Real simple, real simple. Next is A, before we get there, let me remind you of this. Oftentimes people, when we get there, they'll be nervous, they'll be anxious, things like that. And so maybe they're not thinking quite as clearly there. And so let's follow it up with, can you tell me how you're feeling? And once they tell us that, let's ask them like kind of a follow-up question here a little bit. Are you feeling anything else as well? That might, trigger something like, what, one thing is worse, but I am also feeling this second thing here too. So once we ask them what they're feeling, let's follow that up with, are you feeling anything else as well? Now, with all of these, each letter and sample and any of these questions, it is okay and appropriate to ask good follow-up questions. So if the patient, if you ask them, can you tell me how you're feeling? Or are you feeling anything else as well? And we don't just have to, memorize or write down what they're feeling. If they tell you something that requires follow-up, like if you're unclear about what they're talking about, if it's a little vague or anything else like that, you can ask follow-up questions to kind of clear things up a little bit there. So don't think you only are going to ask these questions. We are going to ask follow-up questions to clear some things up for people. So just keep that in mind. A is going to stand for allergies. We want to know if the patient has any allergies whatsoever. It's not just to medications or anything else like that. So we're going to ask them, what are you allergic to? Do you have any allergies? And what we want to know is it medications? Is it anything from the environment? Anything from food? So any allergies whatsoever. I should give you a little shorthand. A lot of times let me see here, pull down my thing. A lot of times, doctors' offices and us and at the hospital, they'll ask about allergies to medications and drugs. So if somebody does not have allergies, we'll say that they have no known drug allergies. And the shorthand is NKDA for that, no known drug allergies. So when you're writing down your information, things like that, that's a little bit of shorthand there. No known drug allergies there. All right, so again, S is signs and symptoms, A is allergies, and we want to find out whatever they're allergic to. Okay. M is going to be medications. Now this one we're going to have to think a little bit about. Excuse me. Maybe some of the medications they're taking have to do with their present illness that they're having, or it could affect the injury that they have. Like for example, if they're taking blood thinners and they're bleeding, it could affect that. So we want to know any medications that they're taking, any of them. All right. So we want to ask and look for a few things. Right. An easy question to open this with is, what medications are you currently taking? Now, people will most often think that we're only talking about prescription medications, right? That's not the case. We do want to know prescription medications, but we want to know about anything that they're taking medicine-wise. So after we follow up with, or after we ask, what medications are you currently taking, we want to follow up with, are you taking any over-the-counter medications? Like, do they take a baby aspirin every day? Things like that, right? So, are anything over-the-counter that they're taking? Are they taking Pepto-Bismol? Something like that, right? So, any over-the-counter medications. And then these next two questions that we'll ask here are real important. Okay. And the reason these questions are important is because sometimes patients will not understand what we're asking, and you can ask a patient some questions, like, do you have, like, for example, do you have any medical history? And that's like, no, I'm healthy. And you get to their medications, this part, and then they bring out like a huge box full of medications, and it's for like diabetes and high blood pressure and blood thinners and this and that and this and that, all these other things. It's like, oh, you do have medical history. So we have to be careful here. We have to make sure we're getting all the information possible that we can get. So part of this follow-up question here is these next two. Are there any medications that you are prescribed but are not taking? This is important to know because medications will point us in the directions of medical problems, right? Like, do people that do not suffer from severe allergic reactions, do those people have prescriptions for EpiPens? No, they don't. Just people that have the allergic reactions do, those severe allergic reactions. So, that's a medication that is prescribed to them that they don't take all the time, but they don't take. They only need to take it when they need it. So there are plenty of medications like that. And so somebody may not list it because like they have it, but they don't use it. But it could tell us about potential medical problems they have. For example, the EpiPen, if somebody's prescribed that, it tells us already that this person has medical issues with allergic reactions. If a patient told me that if I asked that question, are you taking, are there any medications that you're prescribed or not taking? And they told me nitroglycerin, well, that would tell me that they have a cardiac history because only cardiac patients, for the most part, get that medication. And so people may forget that they have it. Maybe they got it prescribed 6 months ago and they've never taken it, maybe longer, right? So what medications are you currently taking? Are you taking any over-the-counter medications? Are there any medications that you're prescribed that you're not taking? And then the last follow-up for the medications is, are you taking your medications as they're prescribed, like you're supposed to? This is a good question to ask because what you'll find, and and it may be more prevalent in our communities around here because we have um, a lot of folks that are at or below the poverty line around here. So what sometimes people will do is they will take a medication, but they will ration it. And so, like for example, there are stories of people that because they can't afford their insulin, they ration their insulin. They don't take it as much as they should take it. So it's important to know that if they do have a medication, are they taking it appropriately? Because that medication may not be effective if it's not taken appropriately, whatever it might be, and it might be the cause of these issues that your patient is having. If it's medical issues, things like that, right? So we're doing a little bit of digging here, right? We want to dot all the I's, cross all the T's here with these medications and make sure that we're getting the whole picture. So what medications are you currently taking? You taking anything over the counter? Are there any medications that you're prescribed that you don't take? And are you taking the medications that you do have? Are you taking them as prescribed like you should? So those are your questions for medications there. And again, important to ask all of these questions here because sometimes, again, it might be somebody's worst day. It might be incredibly anxious. Maybe they're just thinking about the situation that they're in, the present, illness that they're having, the injury that they've had. Maybe they're overwhelmed that there's strangers in the house, at the house, and there's an ambulance there and things like that. And so maybe they're not thinking quite clearly there. Maybe they're not understanding our question. So it's important to follow up with all of these here. Okay. All right. Moving on from M, from medications, I'm going to go to P. And P is past medical history or pertinent medical history. HX is shorthand for history there. So past medical history or pertinent medical history. So those are two kind of different things there. And so let's break that down a little bit. So for past medical history, like, do you have any medical conditions? Have you been experiencing any medical problems? Uh, Kind of dig into that. If they're like, no, a lot of people are fine and they may not have anything. But again, like say, do you have any medical issues? I've literally had people tell me no. And then you dig in a little bit and it's like, oh, they have a cardiac history that they've been treated for. They've got breathing problems that they've been treated for, like all sorts of things. And it's just like, no, I feel fine. I don't have any medical issues, right? So we want to dig into this a little bit. Make sure we're asking a bunch of these problems. So do you have any medical issues? Have you been experiencing any medical problems? Do you have any history of breathing problems? Do you have any history of cardiac problems, any problems with your heart? Are you diabetic? Those are good questions to ask, right? Those are common things: breathing issues, cardiac issues, diabetes, right? And they cover a lot of areas in the body and a lot of conditions and things like that. So those are good questions to ask, some of those follow-up questions, just to make sure we're getting as close to the honest to goodness history as possible. So that would be things for past medical history, those questions there, right? As far as pertinent medical history, what pertinent means is that it is related to what is happening now. Okay. So pertinent means it's related to what's happening now for us. So the question for that would be, has this happened before? Okay. Has this happened before? That would be a good pertinent medical history question. So like if somebody's having, like, let's say an asthma attack, okay, and you say, has this happened to you before? Chances are, if they're an asthmatic, the answer is yes. And so that those experiences directly relate to how they're feeling now. And then we can follow up with other questions because we know that they've experienced it before. And we'll get to those questions when we get there, but that'll lead us to other questions that we can use. So pertinent medical history, has this happened to you before? Another good question to ask in there is, have you had any recent surgeries there? That's kind of, you know, infections, things like that can get into the body, days, weeks, and they can be in the body for a long time too. And so maybe somebody's having issues with that. So have you had any recent surgeries there? That can tell us about, maybe a bleed, maybe an infection, things of that nature. So so it's past medical history and pertinent medical history is P. All right, moving on. So with this, not moving on yet, but with this, again, with all of these, follow-up questions are probably going to be needed, especially with past medical history, or if it's pertinent. Like, let's say somebody's having an asthma attack, and I ask them, has this happened to you before? And they say, yeah, it has. And then we can follow up with, like, okay, compared to the last time this happened, how does this one compare? Is it worse? Is it not as bad? Um, you can ask them to compare it to the worst time that they've ever had it. Right. So what's the worst asthma attack you've ever had? How are you now? How did you feel then? How are you feeling now? We can kind of gauge how things are going for them. So those are good follow-up questions. It's important to remember that to ask them when they come into mind too. Okay. Don't wait for later. If it pops into your head, ask it then. What we're going to learn here is that we're going to take sample kind of in order, real organized as we're learning this and practicing this. So we can, we know where we are in the process if we ask a couple of follow-up questions and kind of get away from the strict SAMPLE. We can ask a couple of follow-up questions, but we can, if we're doing this in an organized manner and practicing in an organized manner, we can finish with our follow-up questions and then bring it back to where we are, and that would be L, the next one there. So L, we'll get to that. So follow-up questions, again, you can ask them anywhere in this sample process or in the OPQRST process, those questions there. So, but again, as we're practicing this, let's go through in order sample, and then that way, if we do have some follow-up questions, we can remember where we are in the process is what the point is. All right, L is last oral intake, and what that means is, when did you eat or drink last, and what was it? This is information basically. If we have a GI problem, then it can relate to us. If it's a diabetic problem, then it can relate to us. Things like that. If the person's nauseous or vomiting, or maybe if it's an allergic reaction, this question can relate to that. It helps also the hospitals, the doctors afterwards. This person needs to go into surgery. They need to know about what they've taken in. If they're going to go under anesthesia, they might have to prep for the patient vomiting and anesthesia, things like that. So it's important to know. It may not have anything to do with their issue, but it very well could there. So a lot of times it doesn't, but It very well could. So we're always going to ask last thing they ate or drank and what was it for last oral intake. And then we get to E. E is for events leading up to the injury or the illness, the events leading up to the present situation now. So again, this is a pretty easy question to ask. This is tell me what was going on when you started to feel this way. What were you doing? What was going on before you got hurt? Like, what were you doing? Describe to me what was going on when you felt these things, when you got injured. So we can kind of get an idea of what was happening there. Okay. How we got into the situation that we are now. Okay. So pretty simple. Events leading up to injury and illness. All right. That's sample. Pretty simple, right? So signs and symptoms, allergies, medications, past or pertinent medical history, last oral intake, and events leading up to the present injury or illness there. Okay, pretty simple, but it does take practice to go through that, which we're going to do. All right, so let's move it on to the next part, which is going to be OPQRST. That's one thing. All right, OPQRST. Let's get through this. OPQRST is going to be an anagram that we're going to use for the history of the present illness. This is what we're going to use to figure out what's going on right now with the patient. O stands for onset. This is onset is when the current illness started or current injury started. What were you doing when the illness or the pain started? This is very similar to E in sample or the events leading up to it, right? What were you doing when the illness or the pain started? So onset and events, the E from sample, are similar. P means provocation. And for this, what it means is does anything make how they're feeling better or worse? Right? Does anything make the pain worse or better? Does anything make their breathing better or worse? Whatever the problem is there anything that makes you or your pain feel worse? Is there anything that makes it feel better? For example, let's say somebody's having a breathing issue. They might say, if you ask that, does anything make it feel better? Well, they might say, well, sitting up and kind of tripoding makes it feel better, right? Or laying down makes it feel worse, things like that. Or if somebody's having dizziness, if they get up and walk around, they get really lightheaded, but it's not so bad if they just sit down or lay down and stay still, things like that. So provocation is does something happen? Can they do something to make their medical issue feel better or their pain feel better or worse? So does anything make it feel better or worse? That's provocation, P. Q is going to be quality. When we say quality, just like with vital signs, when we want to get like the quality of the pulse, remember quality of the pulse, it's not just how fast it is, or right, we're talking about the strength of it, the regularity of it as well. Quality, we're going to be asking we're going to ask the patients to describe their pain or how their problem feels, right? So this isn't asking for symptoms. People can get that confused. This isn't asking for symptoms. We already know what the symptom is. So we're asking how that feels to them. So let's use pain here. Pain is a very easy one to understand here, but it's not the only thing we can ask for quality. So real simple is, can you tell me what your pain feels like? And, is it sharp? Is it stabbing? Is it dull? Is it crushing? Right? We can have lots of different answers there. We can use that for, like, say, breathing. Like, can you tell me how it's feeling for you to breathe right now. Maybe they're like, oh, it feels like I'm breathing through a straw, something like that. Okay, so quality, we want them to describe their pain, um, or that medical situation that they're going through. Um, it's, sometimes it, sometimes this question, like, um, yeah, if you may not ask this, if somebody, you know, um, let's say somebody's having gastrointestinal problems, GI problems, and they've been having diarrhea a lot or something like that. Probably not going to ask them like, can you describe to me how your diarrhea feels, right? So we may not ask this for some things. Okay, the question may not fit, and that's okay if it doesn't. But for most things, it will. We'll be able to ask this. So, quality. Q is quality. It's the patient's description of how they're feeling. Right, of the symptoms that we already know. We want them to describe those symptoms a little bit more. So they could say like an S for sample, signs and symptoms. What are you feeling? I'm feeling chest pain. And at this point, for quality, we would say, can you describe that pain to me? Okay, so we're adding on to the symptoms. We're getting a little bit more finer of a point to it there. All right, R. R means radiation in this case. And this one is basically just for pain. Okay, this one's basically just for pain. And what it means is we want to know where the pain is in their bodies, right? We want them to tell us where their pain is, but the radiation part is, does it go anywhere else? Like, let's say, for example, somebody's having chest pain and it radiates up their neck into their jaw or down into their left arm, right? So radiation, we want to know if the pain is where it is and if it's staying there or if they're feeling it goes somewhere else, right? You have shooting pain that goes down, your arm, things like that, right? So where is your pain and does it go anywhere else for radiation? S is going to be severity. Now, what we're asking the people to do here is to rate pain. Now, it's important to realize that severity is not just for pain, though. Okay, this one, it makes a lot of sense to use it for pain, and sometimes people forget to ask it for other problems. So we're gonna have them rate their pain, and we can do it in kind of a couple of different ways. The most common way, which we should do for pain, is ask a question like this. On a scale of 0 to 10, 0 being no pain and 10 being the most pain you've ever felt, how would you rate the pain that you're feeling right now? All right, so 0, some people will say at a scale of 1 to 10, but 1 means they're having pain. Let's make 0 the number that we use as a baseline. So normal, no pain, right? So on a scale of 0 to 10, 0 being no pain, 10 being the most you've ever felt, not what you can imagine, because I can imagine things a lot worse than what I've actually felt, right? I've had some painful injuries, but I'd imagine that, being eaten by a shark was probably more painful than anything that I've ever had happen to me. So, so don't ask how much pain they can imagine, how much pain that they've actually felt before. So 0 to 10, 0 no pain, 10 being the most pain you've ever felt. Can you rate the pain that you're feeling right now? A note on this: you're going to get 1,000 comedians in the back of the ambulance, and all of them are going to say 12. They're going to say on a scale of 0 to 10, blah blah blah. You ask the question, and they're like, "It's a 12. It's an 11. It's a 15. It's a 20." So if they say that, ask them, like, clarify that. So follow that up with, So this is the worst pain that you've ever felt in your whole life right now. Um, make them commit to it. Make them commit to it. Um, a good number. Anything like 7 or above, like, that's a lot. That's a lot of pain, and they should be in the hospital for it. So anything 7 or above. So if somebody is like, it's like an 11 or 12, it's a 15, whatever. So you can just follow up like, okay, just to make sure, like, this is the most pain that you've ever felt, and you absolutely like should be in the hospital because of it. It's that serious, right? Um, I don't know why people like to throw this joke, like, throw that out there. Like, if you give them the scale and they give you the number that's beyond it, I don't know why people like to do that, but they do. So nail them down to it, right? Nail them down to a good answer. Um, um, if they do give you a number that's above 10 somewhere, so like follow it up with, so this is the most pain that you've ever felt in your entire life. And based on your pain alone, you need to be in the hospital for it. Um, Something like that. You'll get a lot of people that'll back down, like, oh, actually, it's probably not like a 12, maybe it's like a 5, things like that. So just be aware, right? Now, but also be aware that, people have different pain tolerances, things like that. So don't just take it with a grain of salt. Somebody that says like a 12 or something like that, maybe it is. Maybe it really, really is, and we need to believe that. But a lot of people, when you try to nail them down a little bit to exactly how they're feeling, they will greatly reduce that. So if somebody says they're feeling a 12, out of 10 on the pain scale, don't dismiss it out of hand. Just follow it up with a question to clarify, to really to nail them down to what they're feeling there. All right. So severity, a scale 0 to 10, 0 being no pain and 10 being the most you've ever felt. How would you rate your pain right now? Now now that's for pain, right? That's for pain. We can also rate medical conditions, like if they are particularly repeat medical conditions. Excuse me. Earlier, I used the example of somebody having an asthma attack. So if somebody has had an asthma attack previously, we can have them rate the severity of this one based off of that. So, like, compared to your worst asthma attack, if 0 was everything's normal and 10 is the worst asthma attack you've ever had, where does this one fall? Right? Is this one the worst one? Is it not as bad as the worst one? Okay, if it's not as bad as the worst one, right, that would be great. But what did you feel in the worst one? How was it different? Right? So we can rate severity um, with conditions, injuries, medical happenings, there, emergencies, there, where we can compare it to past medical um, history there. So again, compared to your last asthma attack, if 0 is just regular breathing and 10 is the worst one you've ever had, where would you put this one? Um, it gives us some insight into what they're thinking as far as how bad things could be, and it gives them some information, how they're feeling now, what happens with them, and how they're feeling when things get really bad, or it's like the worst they've ever experienced. So we can kind of get some insight there. We can keep that in mind as we're keeping an eye on our patient, and keep that in mind as we're trending things like, okay, is this trending towards what they're feeling at their worst, asthma attack? Again, if we're just using that example, um, or are we staying? Or are we not going to where it was the worst for them? So severity, again, we can use it with pain, and then we can compare it to chronic medical conditions, conditions that people have had before. They've had episodes of that condition before, like, for example, um, asthma, or a diabetic, things like that. Okay, that's severity, S. The last one is T, it's time. So when did the problem or the pain first start? So this is important. Like, so is this an acute emergency? Did this problem start right before they called 911? Or did it start like 4 days ago and it's been getting worse ever since? And they've just decided to call 911 now. All right. So time. How long has this been going on? When did this first the problem first arise? When did the pain first start? It can be used for medical conditions or pain, as most of them can here. So we want to know basically time frame of when this current situation started. And then what we also want to know here with time is how has it changed over time? Did it start like minor and has gotten worse? Did it start really bad and it's has stayed really bad all throughout it? Did it start really bad and it's gotten better, but it's persisted there? So different things can happen. So not only do we want to know when it started, right? How long has this been going on? But how has it changed over time? Okay. Has it gotten better or has it gotten worse since it started? Right. Remember, things can always change. Things are always fluid in EMS there. Again, we want to know if like the pain or the problem was sudden or if it was gradual, right? So again, time, when did it start and has it changed over time? All right, so that's OPQRST, and we'll give you a little bonus there. OPQRST and U. Some people throw U in here. You won't find it in the book, but some people throw U in here. And this is a great question to ask for somebody having a medical problem or a pain due to injury, things like that. What have you done to make this better? Right? Have you taken medications? Have you, right? Did you get stung by a bee and you took a large dose of Benadryl afterwards? Are you having an asthma attack and what did you do to make it better? Well, I've taken 6 doses of my inhaler in the past 15 minutes, right? So what have you done to make it better? Sometimes this might be drugs, sometimes it was just positioning, sometimes it's just calling us, sometimes it's nothing. But sometimes some of the things that they may do is going to be important for us to know. So did they put something on board? Did they take another drug? Did they do some, anything like that? So what have you done to make this better? Is always a good question to ask. All right. So that's it for sample and OPQRST. So putting it all together, though, we want to, this is going to take practice. These are lists of questions, basically, right? 2 anagrams. We've got sample and OPQRST. And right now, as you're looking at this, as you're learning this, it's just going to look like a list of questions for you. But as you practice and as you get used to it, it's just going to become a conversation with your patient. You're going to be looking, okay, I have to ask S, now I have to ask A, now I have to ask M, now I have to ask P, and so on, all the way through it, right? And you're going to, as you're learning this, be pulling yourself out of the conversation. Like you ask a question, you listen to what they say, and you have like, okay, now what do I do next? Okay, I have to learn what this next question is, right? But as you practice and as you get used to it, this becomes like a natural conversation. In fact, some of these questions you may not have to ask because they've already answered some things, right? And so one of the key things in getting good at these questions is learning how to listen, right? We got to make sure we're good listeners here because we may not, again, have to ask a question because they may have given us the answer already. Let me show you what I'm talking about. So let's say we go into a patient's home, right? We get called to a patient's home, private residence. Let's say we're there for chest pain. Doesn't matter, whatever it is. You go in, you do your scene safety, all that. You get your general impression, and again, chest pain person. You do your quick scene size up and all that good stuff, and you ask the patient, "Can you tell me what's going on today?" Like, "Hi, I'm Joe. I'm from the rescue squad. Can you tell me what's going on today?" Again, chest pain patient. Maybe he says this like, "Oh man, about like 2 hours ago, I was out taking all the Christmas lights down off the house and throwing the tree out and stuff, and I really started to get some like a dull pain in my chest. It's just gotten worse, and now I've started to have some trouble breathing on top of it, and it's just like it's going up into my neck now, right? So maybe he says that. How much information did we just get in those couple of sentences there? Did we cover things in sample? Did we cover things in OPQRST? Yeah, you betcha, right? So we got some symptoms. I got a dull chest pain, got some trouble breathing now. Events leading up to it, the person was a little bit active, taking off Christmas lights of the house, getting rid of the Christmas tree, right? So they're a little bit active, putting some strain on the cardiovascular system there. So we know that. What else did he say? Oh, he said he had really bad dull pain, right? We knew that, but we know that he's got radiation too. We also know onset. We also know time. He said it was about 3 hours ago. So, like, just that opening question, "Hi, I'm from the rescue squad. Can you tell me what's going on today?" We might get just a ton of that information. Okay. So, um, and I don't know about you guys, but have you ever had the experience or the customer service experience where you don't feel like you're being listened to? Maybe somebody asks you the same question multiple times, like, sir, can I have your verify your phone number? And you give them your phone number, and a couple minutes later, like, can we have your phone number again? It's like, I just gave you my phone number. Why do I have to do that again? People will get upset being asked multiple times the same things, the same information. It feels they don't feel seen. Um, they don't feel like they're being listened to, and that helps to erode the trust that we're trying to build. And so, being a good listener, hearing all that stuff, paying attention to what they're saying is super important. Now, if somebody gives me a whole bunch of information right off the bat, I say, "Hi, my name's Joe. I'm with the rescue squad. Can you tell me what's going on today?" And they give us that whole story again, right? Oh, it was 3 hours ago. I was, blah 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 blah. Right? It is okay to practice active listening and confirm what you heard. Right? So when you get down to, let's say, E in sample events leading up to the present illness, okay, so you said that you were taking down Christmas lights and taking down the Christmas tree, doing some physical activity, were it correct? And they can just say yes. Right. So that means from what the patient's point of view is, okay, he heard me and he's checking back in on this, right? It's going to, it's going to help build the trust, things like that. So I don't have to ask, what were you doing before this? That makes it sound like I wasn't listening to the first answer that he gave me. So you can always, with active listening, just check back in, right? So you can say, okay, and time, when you get down to T for time, OPQRST, or radiation. Okay, sir, and you said that your pain, if we're doing radiation, you said that the pain that you're feeling, you said it was going up into your neck, into your jaw. Is that correct? Yes, it is. That's exactly what it's doing. Okay, or is it going anywhere else? No, just right here. Right. So not only did we confirm what we heard with the patient, but we had a follow-up question with it too. Okay. This is all going to make more sense once we start practicing together in class, and I'll have handouts for you for patient information, and we're going to start a whole bunch of acting here in class and practicing with each other. But this takes time, and it takes practice to take this from just a list of questions to making it a conversation with the patient. Right? We got to work to get there, but that's what we're going to do. Okay, great. So that's an overview of OPQRST and sample questions. Make sure you've got good notes on that kind of stuff. We're going to be digging into this a little bit more in chapter 15 there, but we're going to start practicing now. All right, guys, thanks, and we will see you next time.